For people who are at risk of getting a pressure ulcer, it is important that skin is checked on a daily basis. But what should you look out for? Think pink. The first sign of a pressure ulcer is when the affected area of the skin appears discoloured. The skin may also be tender, numb, itchy, hotter, spongy or hard. Seek advice promptly. Pressure ulcers can also start where the skin is dry, cracked and callous, and look for blisters or bruises too. Skin can also be damaged by incontinence or persistent moisture in skin folds. And where should you look? Most pressure ulcers occur on the sacrum, buttocks and heels. They are also likely to develop nearer any bony prominence such as shoulders, back of the head, tailbone and even toes or the rims of the ears. If you're in a wheelchair or sit in a chair for long periods, they may develop on pressure points such as buttocks, spine, the backs of arms, legs and hip bones. A red area should disappear within 30 to 60 minutes after the pressure is removed. If it doesn't, a pressure ulcer may be developing and you need to take action. Try to remove the pressure. Use a pillow or some soft padding over the area if you cannot stay off it. Do not rub or massage the area and seek advice promptly as the tissue damage can deteriorate rapidly. There is a wide range of equipment available to help reduce the risk of pressure ulcers, so you should make sure you know what to use and how to use it. Many pressure ulcers begin in bed, so let's start there. Check the mattress. Is it still suitable or does it need replacing? Sheets should be kept free from creases and crumbs as these may cause damage to the skin. Equally, wet bedding should be changed immediately because moist skin is more likely to break down. Some aids can prevent sliding down in bed, which causes rubbing and friction. A pillow can be used under the leg to remove pressure on a heel or help repositioning in bed, but so can standing for a few moments. Ask for help if needed. Wheelchairs should provide users with the right support for good posture and a sitting position to reduce unnecessary pressure. Wheelchair cushions need to be fitted correctly, checked daily and replaced regularly. Padded toilet seats and shower chairs can be used if people are at high risk of pressure ulcers. Sheepskins, waterbed and donut-type cushions are not pressure-relieving aids and shouldn't be used. Specialist seating, mattresses, beds, moving and handling hoists, footwear and insoles are available and they should be used where appropriate, following an assessment of need. But all users must be taught to use the equipment safely and know who to call if the equipment fails. The risk of people developing pressure ulcers can be reduced by keeping the skin in good condition. Some simple skincare practices can really help. Keep your skin clean with mild soaps or cleansers and dry gently. Protect your skin from friction, creases, hard seams and buttons and wear loose clothes to allow air circulation as sweat increases friction between skin folds. Keep lotions and potions to a minimum, but using a simple moisturiser regularly helps. Stick with one that suits your skin and seek advice if unsure. Use talcum powder with caution as it can collect in lumps in skin creases, contributing to friction and skin damage. Barrier creams can be useful, but do need to be compatible with incontinence pads. Seek advice from your healthcare professional. Do not rub or massage pink or red areas of the skin. Nails should be kept short to avoid causing scratches to the skin, and likewise jewellery shouldn't be worn, especially during turning and positioning. When it comes to baths and showers, always test the water temperature to prevent scalds and be aware that hot taps and hot pipes in the bathroom can cause burns. In the bath, sitting on a cushion will protect the skin and a padded shower seat can be used for showering. Don't forget that after a bath or shower is a great time to check your skin for early signs of pressure ulcers. Drinking enough and eating a healthy, balanced diet that contains an adequate amount of protein, plenty of vitamin C and zinc can help to prevent skin damage and speed up the healing process. Here are some simple tips. Maintain fluid levels. Fluids keep the skin and muscles supple, making it resistant to the start of a pressure ulcer. Dehydration can make people feel ill, confused and unsteady on their feet, increasing the likelihood of a fall, which can increase the risk of developing pressure ulcer. Keep a close eye on fluid intake. Are you happy that 500 millilitres is being drunk every 4 hours? If not, what prompts and checks need to be established? Protein is essential to help the body make new tissue. When we don't eat enough protein, our tissues become weaker, and when damaged, they are slower to heal. Vegetarians need to eat high-protein alternatives to meat, such as cheese, yogurt, peanut butter, custard, beans and nuts. Remember that vomiting and diarrhea can cause dehydration, and additional fluids will be required. Some people will be helped by eating a number of smaller meals throughout the day rather than 2 or 3 larger meals. If swallowing is difficult, try specially made nutritional drinks or pureed foods and soups. One of the things you can do to help prevent or help to heal a pressure ulcer is to keep a log or a diary to record the progress of the skin condition. This can be given to a healthcare professional so that they have the information needed to prescribe the best treatment. So what should you make a note of? Simply note the date the skin changes are first noticed, and any of the following. Discoloration of the skin, usually over a bony area that doesn't go away. This can be light pink or dark pink on pale skin, or darker patches on darker skin. Blisters or skin damage over a bony area. The area of the body where this was noticed. What it looks like and how big the area is. A photograph, if you can, is a very good idea, as these very clearly show the progress that is being made. Also, record things like difficulties with eating and drinking, problems moving about, incontinence, or staying in bed or sitting for longer than usual. Pressure ulcers can last a long time, and it can be very easy to forget what triggered them in the first place, what helps them to get better, and how they are changing. Keeping a simple record like this can help make a big difference to successful prevention and treatment. Nothing prevents a pressure ulcer as much as movement. Making small but regular and frequent changes to position and redistributing pressure reduces the risk of a pressure ulcer. It is also a key part of the healing process because it gives the wound the best chance of healing. What do you need to do? People with normal mobility do not develop pressure ulcers, so try to maintain your usual mobility. If you can't, ask for help. Your mobility can be assessed and a plan agreed to assist. For example, would a walking frame help you? Always wear shoes with firm soles that fit well. Make sure that walking aids are being used properly. Check them regularly for wear and tear or damage. And don't forget to check for skin damage after they've been used, especially if your legs or feet are swollen. Keep an eye out for a reduction in your mobility. You may need to adopt new practices to prevent a pressure ulcer. If you're in a wheelchair, you need to change position at least once every 15 to 30 minutes. If you are confined to bed, you need to change position at least once every 2 hours. Lastly, when using a hoist, use the correct size of sling. Slings that are too small or too large may cause pressure damage to the skin.